What's up everyone? This is Stephen Loam, lifestyle medicine cardiologist. In this video, we're going to go over 5 common myths and misconceptions about the ketogenic diet. But before we get going, don't forget to subscribe, like this video if you like it, give me a comment below afterwards and tell me what you think. What is the ketogenic diet? It's a diet that severely restricts carbohydrates. It excludes breads, pasta, sugar, milk, corn, beans, and rice, and focuses on eggs and dairy, oils, and meat. Yes, some nuts and seeds are allowed, some vegetables and berries in very small amounts as long as you don't exceed a certain amount of carbohydrates. This puts you into a state of what's called ketosis, which is actually the same thing that happens when somebody is starving. And a lot of people lose weight on a ketogenic diet, some of their biomarkers get better, but is it good for you in general? Let's get to these 5 myths. Myth number 1. The ketogenic diet is good for type 2 diabetes, and really the cause of type 2 diabetes is carbohydrate toxicity. This is absolutely false. Type 2 diabetes is not carbohydrate toxicity whatsoever. Yes, there is some intolerance to eating carbohydrates. It can make your blood sugar go up in the short term, but the big picture of type 2 diabetes is over-calorie consumption and, more importantly, over-consumption of fat. When the fat gets into your cells, you become insulin resistant. That's one of the reasons why weight loss is the biggest, most important thing for controlling type 2 diabetes. You could actually eat all the carbohydrates you want as a type 2 diabetic if you keep them unprocessed from whole foods and keep your diet very low in fat. This has been shown in randomized controlled clinical trials with a whole food plant-based low-fat diet being more superior than the American Diabetic Association diet for diabetes control. I'm going to link a whole bunch of awesome resources in the description below about type 2 diabetes, ketogenic diets, and really the proper way to control your type 2 diabetes with diet. And this makes tons of sense. The blue zones, longest living cultures in the world ever described, are a very high carbohydrate culture, and they get their carbohydrates from fruits and vegetables, beans and lentils, and whole grains. They don't really have type 2 diabetes in their culture despite the high carbohydrate content because they're unprocessed whole carbohydrates. There is no physician anywhere in any specialty that should ever recommend sugar or refined carbohydrates such as white flour products. That's absolutely horrible. And of course, ketogenic diets exclude sugar and white flour. Well, so do other types of diets too, like a Mediterranean diet or a more plant-based diet. So as long as you're getting rid of the sugar and the refined carbohydrates, the other types of carbohydrates from fruits and veggies, beans and lentils, whole grains are absolutely fine to consume. The key is keeping it low in fat. Myth number 2, a ketogenic diet is good for long-term weight loss. Absolutely false. While it is true people can lose weight on a ketogenic diet in the short term, is it good for you long term? Well, look at all the possible side effects that people can have from the ketogenic diet. But even if you do tolerate it in regards to symptoms and side effects, is it really good for you in the long term? Experts talk about the risks of the ketogenic diet, not just the brain fog, but constipation, cholesterol goes up, kidney and liver issues, and yes, you can get nutrient deficiencies on a ketogenic diet. Myth number 3, a ketogenic diet is fine for people with cancer or for cancer prevention. Again, absolutely false. Currently, no major cancer health organization, including the American Institute of Cancer Research and the American Cancer Society, recommend a ketogenic diet for cancer patients or for cancer prevention. And actually just the opposite. The American Cancer Society recommends a predominantly plant-based diet with fruits and veggies, beans and lentils, and whole grains. An apple a day keeps the doctor away. Anytime a diet tells you can't even eat a single apple because you won't be in their dietary plan anymore, you know there's a problem. Myth number 4, a ketogenic diet is fine for heart health and can prevent heart disease. Absolutely, absolutely false. I am a cardiologist, board certified, and I've seen lots of patients in practice for 14 years. And I have seen people, plenty of them, have lots of heart attacks and strokes while consuming a ketogenic diet or other variants of low carbohydrate diets. And again, the research shows you can lose weight. Some people, a percentage, some of their biomarker parameters can improve, their blood pressure. In some people, their cholesterol can improve, but in many people, the cholesterol goes way up. Check out this Mayo Clinic study of people on a ketogenic diet where their LDL cholesterol went up to greater than 300 when they got put on the ketogenic diet. That'll dramatically increase your risk. We certainly know that no major cardiology heart health organization recommends a ketogenic diet for long-term health. What is the recommendation? A plant-based diet, of course. Check out my video on lifestyle medicine and heart disease to learn a lot more about how you can use a lifestyle medicine approach for heart disease prevention. Myth number 5, the general sentiment that the ketogenic diet is a safe diet and it's fine for anybody to do. Absolutely false. We just talked about that it's not recommended for cancer, it's not recommended for heart disease. The weight loss is only short-term and is not really good for your long-term health. So what the heck? Why would this be a safe diet? Why would somebody think that consuming high amounts of dietary cholesterol and saturated fat with high amounts of animal protein are good for you? Look at this research on animal versus plant protein, showing that when you substitute plant protein for animal-based protein, mortality goes down no matter what the source of animal-based protein. So you want to live long and you want to live well. Do not follow a ketogenic diet whatsoever. The current guidelines for heart health is to follow a plant-based diet. Check out my video on the ketogenic diet called Keto Kills. It goes into a lot more detail about all of these different things. Don't try the ketogenic diet. Well, I hope you liked this video on 5 myths regarding the ketogenic diet. Don't forget to subscribe to my channel and like this video. Give me a comment below. Check out some of my other videos, the Keto Kills video. Check out my video on eating bacon, you keto people. Check it out. Stay healthy. See you next time.